Hi, my name is Lukolic. I'm a gastroenterologist here at Nanticoke Physicians Network, and I just wanted to share with you a few thoughts regarding intestinal diseases. Often I get asked what's the difference between irritable bowel syndrome and inflammatory bowel disease, IBD and IBS respectively. Which one basically is associated with developing a colon cancer. Colon cancer is most often associated with inflammatory bowel disease. Of the cancers that affect both men and women, colorectal cancer is the second leading cause of cancer-related deaths in the United States, and the third most common cancer in men and women. With improved screening rates, the rates of death has steadily been declining. Patients with inflammatory bowel disease are at greater risk of developing colorectal cancer and need to be screened more often. Currently, prevalence in the United States of irritable bowel syndrome. The prevalence these days is really unknown, even though we feel that a lot of people go underdiagnosed. Many patients don't seek medical attention for symptoms indicative of irritable bowel syndrome. Most patients with IBS in the U.S. go underdiagnosed. The overall prevalence of IBS in this population in the United States is about 14.1%. However, only 3.3% are medically being diagnosed. The prevalence of inflammatory bowel disease, we currently believe that there's between 1 and 1.3 million people who suffer from IBD. The etiology is multifactorial: environment, genetics, diet. Some also suggest oral contraceptives, perinatal and childhood infections, and atypical bacterial infections have been suggested, but they're not been proven to cause a role in this, in developing IBD. What are some of the signs and symptoms of IBD and IBS, respectively? So, inflammatory bowel disease involves a chronic inflammation of all or part of your digestive tract. IBD primarily includes ulcerative colitis and Crohn's disease, whereas irritable bowel syndrome is a widespread condition involving recurrent abdominal pain and diarrhea or constipation, depending which variant you have, or both, often associated with stress, depression, anxiety, or previous intestinal infection. What it is poorly coordinated signals between the brain and the intestines that can make your body overreact to changes that normally occur within the digestive process. This overreaction can cause pain, diarrhea, constipation, and a significant amount of distress to the patient. Inflammatory bowel disease, the exact cause is unknown. However, it's a complex interaction between environment, genetics, immune system dysfunction, leading to the body's immune system to attack itself. Now, discussing management options, they differ between IBS and IBD. With irritable bowel syndrome, we often recommend diet and lifestyle modifications, soluble fiber, or medications which alter the gut secretion of fluids into the colon. However, inflammatory bowel disease is a bit more complicated. Patients often need medications which target the healing of the intestinal system, specific pathways dealing with immune cells and their production of certain factors. A cornerstone of maintaining remission is close follow-up with your primary care doc and GI doc, including a healthy lifestyle, smoking cessation, and preventative medicine as described by national screening guidelines. Often we get asked what Nanticoke can offer. We can provide diagnosis, treatment, and a comprehensive follow-up of these conditions by a team of highly skilled physicians, nurse practitioners, and surgeons experienced to manage these conditions and their complications. Please feel free to give us a call at 302-990-3300 or visit our website at nanticoke.org.